Hey everybody, welcome to the Coeur Biohacking and Wellness podcast. This is our first episode. I am your host, Shayan Yazdani, owner of Pop Chiropractic, and I'm joined here by my co-host, Gunnar Amos. Gunnar, you can introduce yourself.
Yep. Hi, my name is Gunnar Amos. I am the Director of Biohacking and Recovery for Bioperformance Institute, the CD Resort Shops location, and our Post Falls location as well.
Cool. Oh, I should probably do this.
Yep. Cool.
You can pick and choose too what you do from there.
Okay.
Yeah, it doesn't have to be everyone.
Okay. Do you want me to call you Cheyenne or Dr. Yazdani?
Cheyenne.
Okay. Okay, Cheyenne. Tell me a little bit about your background and what initially got you interested in studying chiropractic and becoming a chiropractor.
Yeah. So that story starts when I was in college. I was a biology major, and I was really interested in human anatomy, how the body works, how the body moves, the processes of the body.
Mm-hmm.
And at the time, I was getting very into health and fitness. I had just started working out, eating right, and learning about the process of the body at a more physiological level. And so that piqued my interest when I went to school. And so I studied biology, and I knew that I wanted to be a doctor of some kind, but when I went into school, I didn't know what kind of doctor that would be. I had come from a family of doctors. My mom and dad were both dentists. My brother, he's now would be going to medical school and has now graduated. He's an anesthesiologist. My sister was pre-med as well. So I almost think that it was destiny in a way, and just being around it so much kind of led me down this path. And looking back, I remember when I was trying to figure out what do I want to do for my career, what do I want to do for my job, it seems so taxing and so very lost feeling of what I wanted to do.
Mm-hmm.
But looking back now, it almost seems like destiny was forging me to go down that path. And it seems a lot more clear. But I started by, I was in my fourth year of college, and I was looking ahead and saying, okay, well, I'm almost going to be graduating here pretty soon. I need to be specific about what line of work and what my purpose is going to be. And so I started going and shadowing a lot of different kinds of doctors. I started with a veterinarian, then an optometrist. I already had experience with dentists through my parents, and orthodontists. I had braces as a kid. And one by one, I kind of figured out what I liked and what I didn't like from each one of those fields. And when I look back now, you look at the person, and this is something I've become more passionate about recently, is helping people figure out what they want to do. But I would look at the person and see what's their lifestyle, what kind of income are they going to make, do they have balance in their life? That was probably my top priority, was balance more than necessarily income or substantially what I was doing. And so I was getting so stressed over this, and I started to have this tightness going down my neck and upper back, and this is like one of the most common spots that now I see with my patients, that was so tense I had to constantly just be rubbing out my shoulder nonstop, and I would have radiating pain that would go up kind of to the base of my skull and give me headaches, and almost it would be so bad sometimes that they would spasm and I would briefly lose my vision. It was almost like a mirror was being shined into my eye. And so I had to go get treatment for this. It was affecting how I live my life. And so I found a chiropractic offer. It was on Groupon. It was a chiropractic session and 1 hour massage. And so I didn't have any experience with a chiropractor before this. I didn't know anybody who was a chiropractor, but I went to this guy, and he did some work on my neck. He adjusted my neck, he adjusted my mid-back, he adjusted really my whole body, and then I had a 1 hour massage, and it was it wasn't like the massage that feels good. It's the one where the elbow's in there and you're clenching and you're just, it's the hurts so good kind of pain.
Mm-hmm.
And so a day or two later, I was very sore after that session for a day or two, but then the tightness that I had in my neck and upper back was 80% gone. The episodes where I would lose my blindness almost daily or every other day were gone. I actually haven't had any of those since then. And that was now almost 10 years ago. And so it led me down a path that I had not considered. And so I started looking into it more. I started going on YouTube, seeing what kind of what do chiropractors do. And I was really inspired. I saw a lot of videos of chiropractors naturally, through adjustment, taking someone who was hunched over, bent over, barely able to walk in severe pain, to standing up straight and walking out of their office 15 minutes later. And I thought, this is amazing. This is incredible. And I was very inspired. And there was a couple of chiropractors who I remember watching. One is Dr. Jason. He's another chiropractor. He's Persian like me too. So when you see someone similar to you, it's kind of feels a little different. Dr. Ian, he's out of Australia. He had this video where he adjusted this young Indian boy, man, who was trying to pull a tree root out of the ground and just tweaked his back so bad that he could never stand up straight anymore. And you just watch the progression of him getting his life back. Because that's really what you're doing with this, is you're giving people a piece of their life back that's been taken away from them. And so after that experience with that doctor, I looked up, I had gone through all the chiropractic videos on YouTube, and I asked my parents, hey, do we have any family friends that are chiropractors? And they said, yes, we do. We have 2. And when I spoke to them, they said, and I knew them, they're distant family friends, but they told me, both of them, Cheyenne, you're a perfect candidate for this kind of job. You have the type of build that it requires. You have to be in shape physically, not only to perform what's required of the job, but also so that when a patient comes in and looks at you, you are an image of health. And they know that they can take advice from this person. And so when I heard that, it was very reassuring. And I began looking into chiropractic schools. Just from a Google search, I found that there was a school within 30 minutes of where I lived. It was so convenient. And so I went and I applied an application. I put in an application for their program. I looked at their prerequisites, and as a biology major, I mean, you pretty much had all the prerequisites completed, similar to if you were going to go to medical school. And so I put that application in, and they said, hey, we would like to have you for an interview. I went, I did the interview, and after the interview, they sent me an offer to join their cohort. And I was very nervous about doing this because it would be 4 years, a lot of money, and choosing a path. And basically, once you choose this path, you're going down it. And it's to turn around, there's no turning back. And so when I went to school, I had such limited experience with chiropractors just from that one experience. But as I went through school, I had more experiences where I had injured my back and a classmate helped fix me. And finally, towards the end of my program, as I went through my internships, I got to meet a lot more other chiropractors and work closely next to them and see the patients that they were treating. And when it really clicked for me that I was in the right field was I looked around at all these chiropractors and I saw that they were future versions of me, very similar in personality, in demeanor, in their interests, and I knew that I was in the right place. Yeah. And it was a very, you never know if you're doing the right thing. It almost kind of feels like someone has to tell you you're doing the right thing, but when you have that feeling that you are, it's a lot of motivation to continue. And so when I got out of school and I started treating my patients, they said, wow, you're really good. I've been to other chiropractors and I've never been adjusted the way that you have. I've never had more than just my neck and back adjusted. You do the whole body, things that they've never experienced before. And that's when I realized, okay, this is really like something that is a special path for me, or that I have a talent for. And I look back realizing I was one of those kids who like popped their back and neck and all these things and figured out ways to do it. So again, hindsight's 20/20, but it's a perfect fit.
Yeah,
Yeah.
that's awesome.
Yeah.
That's a great journey.
Yeah, I don't think that there could have been a better path for me.
Yeah, sounds like it was kind of destined for you.
Yes.
I guess a question for me to you is, what is the difference between a education for a chiropractor compared to like a physician, a primary care physician? Is there anything different with that, or what was your process of education to become a chiropractor?
Sure. So the process for both is pretty similar because you're pretty much both becoming a doctor. I mean, you are getting the title of doctor of chiropractic, compared to doctor of medicine or doctor of osteopathic medicine, which would be DO.
Yeah.
And it's similar. The curriculums, you're doing a lot of anatomy, physiology, studying viruses. You're in a lab, cadaver lab, doing real dissections on actual dead bodies. You're not just looking at models and doing it in a classroom. It's very similar. And I would compare my coursework to my brother, who is a DO, anesthesiologist, and it's very, very similar.
Okay.
I can't say that it's the same. I definitely think that medical school is a little bit more rigorous, but it also makes sense too because the types of cases that they're dealing with are a lot higher stakes, and so they have to watch out for more things. But I would say that they're about 90% the same.
Okay.
Yeah.
So can you explain to us a little bit more of the paradigm between like seeing a primary care physician, seeing a chiropractor, seeing a PT when it comes to pain in general, just as a blanket term? Like where does that paradigm happen between those three providers?
Sure. I would say the biggest paradigm is between the primary care physician or your doctor who you go see, who's a MD, and a chiropractor, is that the doctors historically have just prescribed medications in order to treat the symptoms that you're experiencing. So you're having high blood pressure, I'm going to give you some statin medications to get your blood pressure under control. You're having lower back pain, I'm going to give you an anti-inflammatory medication or a pain reliever. But the problem there is that you're not actually fixing the root or the source of the problem, you're just giving it a Band-Aid. And eventually that Band-Aid falls off. And then it becomes harder to stick another one onto it.
Yeah.
And I think with what we were talking about earlier about that shift that's a big part of it. People are no longer wanting the Band-Aid.
Yeah.
They are wanting permanent solutions and real solutions that don't involve medications. They want natural methods. And so I almost don't think that the timing could have been better to be in this space, in the alternative medicine space, because people are looking for that. I can't tell you how many times a patient has gone to their doctor and they came and brought their 4 or 5 medications, prescriptions. They said, I don't feel comfortable taking all this. I want something else, another option. And so obviously, I want to help them in whatever way I can. And there are indications for certain ones. Like there's going to be times that they need a medication or they're going to need a surgery. And I'm not saying, oh, never take those things. But it's nice to have an alternative method as well.
Yeah.
And to answer the second part of that question, chiropractors and physical therapists. So there really seems to be a divide between chiropractors and physical therapists, just because chiropractic is a little bit more Eastern, I would say, Eastern medicine, and physical therapy is as Western as you can get for natural methods. And I think that they are more similar than they are different. You're using the body's natural methods for mobility and strength in order to restore proper function to your joints, your muscles, your ligaments, whatever it may be. And between the two of them, you want to use them both.
Mm-hmm.
They go hand in hand. The chiropractic adjustment is giving you mobility and range of motion through your joints, and physical therapy is more addressing those soft tissues, so your muscles, your tendons, your ligaments, and strengthening all those to hold the skeleton together and operate as it should.
Okay, that's great. That's great information. You had spoken a little bit about chiropractic, you focusing on finding the root cause of what's going on. Can you tell us a little bit more about your process if a new client came in and how you approach finding that root cause for them?
Sure. So the process for most of my clients actually starts on Instagram, and that's where I market myself. They say, hey, they find me just through a video, and I do a mini consultation just to qualify them that they're someone who should even come in for chiropractic care. I say, did you just have a recent car accident where maybe they should get an x-ray instead? But what the typical process looks like is a patient comes in and they have their pain, it's their neck or their lower back, and we'll sit down, we'll do a consultation, and the consultation will start with a history. When did this pain start? Has it been getting better or worse since it started? Are you having numbness and tingling that goes down your arms or your legs? Do you have sharp shooting pain? And really try to identify what's the source of the problem, whether it's the joint or a nerve being pinched, which nerve is being pinched, and then seeing if this is a patient that's going to respond well to chiropractic. And so after we go through that exam, the second part of the history is the exam. And the exam are using orthopedic tests that puts stress on different structures. So some of them are going to put stress on the discs, some of them are going to put stress on the nerves, some of them on certain joints, to target and narrow down, this is the pain generator, this is the source of the problem, this is where we're going to be adjusting, or this is where our focus is going to be. Although there's one spot that's typically injured or where the pain is coming from, there may be a myriad of different factors that are contributing to that. Maybe they recently hurt their knee and they're walking funny on that, or they have a muscle imbalance that's led to this joint being achy, or maybe they spend too much time sitting all day or standing all day, and so really finding out what that problem is and then creating a plan to adjust them and to attack that problem. So after they go through that history and exam, we do an adjustment. We do a review of findings and then an adjustment. And the adjustment typically takes about 15 minutes, and they are going to feel a relief right away. That's one of the beauties of chiropractic, is that the relief is instantaneous. It's almost like the good kind of instant gratification. Yeah. Because you walk in, you can be in a lot of pain, and a couple minutes later, you can have no pain at all. However, it typically takes a couple of adjustments to fix a problem, especially if it's something that has been coming on over a long period of time, or a pain that's been present for a long period of time. And to tie this back to physical therapy, I like to say that the chiropractic is kind of a shorter term relief in pain and range of motion, increased range of motion. And if you want to lock in those gains, you want to do physical therapy as well. Okay. Physical therapy with a provider, or just by being active in the gym and strengthening those muscles that way. Okay. Yeah. Okay.
What would be some precautions or contraindications for someone to getting chiropractic?
Sure. This is a big topic because one of the kind of things that floats around in the news is chiropractic is going to cause a stroke. Yeah. And so I don't know what the exact number is, the stats on this, but it's somewhere around 1 in 20 million chance. That's very, very, very low. And so the things that you want to screen for, I mean, the worst thing that can happen is a stroke from a chiropractic adjustment. And this can happen when you have an adjustment of the upper cervical spine and you have someone who's showing signs of transient ischemic attacks, meaning they're having drooping of the face, which is already suggesting that they have some oxygen, blood oxygen being cut off to their face. History of stroke. Also, if they've come out of a recent car accident or fall where there's severe blunt force trauma to their head or neck, and you're then trying to adjust that area, and bone is pretty sharp when it's broken, so if you're doing that, you can be causing more damage there, and that's when you really want to take an x-ray.
Okay.
Yeah, and that's kind of a topic that people ask, do you take x-rays? Sorry if I'm transitioning, but
you're good.
People ask me all the time, do you take an x-ray on the first visit? And you really only need an x-ray when you came from trauma, where you really need to rule out, okay, there's not something broken in the neck, and then I'm going to be going and moving it around. Yeah.
Okay. I like that. I'm not a fan of getting x-rays regularly, so I don't think unless it's needed, you don't really, why would you do it?
Right.
Yeah.
Yep.
So I've, before I had adjustments from you, I had seen another number of chiropractors beforehand. It seems that when I was at previous chiropractic clinics, I usually was only getting adjustments on the area of concern. Then when I came in and got an adjustment from you, it felt like it was an entire body adjustment or reset. Can you speak a little bit more to how you differentiate your adjustments compared to maybe what other chiropractor would do?
Yeah. So the reason why most chiropractors only adjust the neck or the back is because historically, if chiropractors were in network with insurance, the insurance only pays them to adjust the neck or lower back. They cannot bill a code for an extremity and get paid for it. And so there's a financial disincentive there. So that's one piece. The second piece is, in chiropractic school, the focus is on the spine. They do teach you how to adjust other areas like the knee and ankle, but it's not stressed as rigorously as your spinal adjustments. And so what ignited me to do full body adjustments was, people are not going to just come in because their neck hurts or because their back hurts. They might have a problem with their shoulder. They might have a problem with their ankle. They might have a problem with their hip. And when you have someone come in and there's nothing that you know how to do to fix them, or even just do something to give them a little bit of relief, it's not a good feeling. And so that really put a fire underneath me to go learn as many different adjustments and treatments and treat as many different areas as I possibly can. What I would say is the absolute must areas for adjustment are any joints that are weight bearing, so affected by gravity. So that would be your head, neck, spine, hips, knees, ankles, your feet, because those have compression all day long and are more likely to get stiff as compared to your shoulder, your elbow, or your wrist. I would say for those, they're non-weight bearing joints. They kind of hang and float, so they already have a lot less pressure on them and lower risk of arthritis too as you age.
Okay.
Yeah.
Okay. A question that I get a lot when it comes to hyperbaric is, are these results going to last forever? What do you say to clients when they're asking that question of how long are these results from chiropractic going to last me?
Yeah, that's a great question. I would say that the results are going to last you as long as the tasks that you are doing to that's causing that pain, as long as you're doing something that's giving you pain in your lower back. So let's say you have a job that's sitting. I can adjust you and you can get relief in your lower back from sitting all day. But if you go back and do the same thing tomorrow and your back hurts again, well, the relief is only going to last for one day. So it's a combination of it lasting from the extra mobility that you get and relief from the adjustment, but also what you do outside. So it's kind of hard to answer that and say a chiropractic adjustment is going to give you relief for 3 months or whatever. But what I do recommend for most people is to get adjusted on a regular basis. That way you're almost constantly in a state of getting relief for your body and for those joints, so they don't spend such a prolonged period where they're stiff and not mobilized and not moved. And motion is lotion for the joints and circulation. It's almost like when you're not using it for pain relief, I think that you should also be using it for preventative maintenance.
Yeah.
Just like you do an oil change for your car every 3,000 miles, it's almost like doing a tune-up for your body.
Yeah. Yeah. Okay. Where was I going to go here? What would you say is the top application of chiropractic that you see on a day-to-day basis?
Sure. The top application is neck and lower back pain. That's the bread and butter of chiropractic. It's pain relief for your spine. And just the nature and anatomy of our human body and human skeleton lends itself to a lot of pressure on our spine and on the discs in our spine, the joints in our spine. And naturally, we have a posture where we're looking forward, and naturally our head comes forward, our back comes forward, and it just puts a lot of strain on the lower parts of the neck and the lower back. And so that's where chiropractic is money.
Okay.
Yeah.
Okay. It seems to me, and you had mentioned in sort of your initial story of your introductory to chiropractic, that you had sort of an immediate benefit from it. Would you say is the general percentage of people of when do they see results from chiropractic? Is it after that initial adjustment, or does it take some time?
Yeah. It depends on the case. A lot of people from just that very first session, they're going to feel a relief. There's no way they're going to come to my office, they're going to have their body adjusted, they're getting 15, 20 different adjustments in that session. There's no way they're going to walk out of there feeling the same. But if you're having an issue that's more persistent, and this is the majority of the cases, you're going to see results within 2 to 4 sessions. If after 4 sessions you're feeling the same as the day you came in, then you may have to look to alternative methods and try something else. That could be acupuncture, that could be physical therapy, that could be moving to something more invasive like injections, corticosteroid injections, PRP, stem cells, and you just work your way up the ladder, going from most conservative to least conservative up until you get to surgery. That's pretty much your last stop. After surgery, there's nothing else. And so it's good to be able to offer that to people at a reasonable price to be able to come in, because a big fear, especially someone who's not in the medical field, if they have something wrong with them, am I going to need surgery? That's kind of where their mind first goes to. And the answer is no. Majority of time, you do not need surgery, and a surgeon shouldn't really be the first person you go to either. Yeah.
You talked a little bit about price. Are you billing insurance for chiropractic? Are you doing mostly cash pay? What does your pricing structure look like?
Yeah. So my pricing it's exclusively cash pay. I am not in network with any insurance companies. I do not do any car accident cases or workers' compensation cases. My care is directly from me to you. There's no person in between us, and I think that lets people get the appropriate care that they need. A couple of problems with insurance is that they will only grant you a couple of visits, a certain number of visits. That could be 8 visits, 12 visits, and someone could need more than that, or they could be responding well, but they just need a little bit more care. And basically, the insurance company is the one acting as a doctor and not the doctor themselves. Yeah. And then the second part of that is on the doctor side and just business side, running an insurance practice is very difficult and not cost effective due to having to offer so many more things and bill and have the staff to support that. It's just not, in this day and age, a profitable business venture. And ultimately, no matter what you do, you have to be able to make it work financially as well. And these days insurance is not viable to have a business with chiropractic.
Okay.
Yeah.
Tell me if I'm wrong, but my sort of interpretation on chiropractic and stress is chiropractic seems like a little bit of a sort of a central nervous system reset. Can you talk a little bit more on how chiropractic adjustments can have an effect on things like stress and anxiety for people? Because I've heard some of your clients have mentioned to you in passing that they've had improvements in sort of their psychological aspect with a chiropractic adjustment.
Yeah. Well, the reason that chiropractic helps with stress and anxiety and psychological issues is because those issues are more than just mental. They manifest themselves physically. They manifest themselves in your neck and upper back becoming tense and tight, just your body becoming tense, and you're giving your body a release, and you're giving your body endorphins that make it feel good, and that's how you're getting that relief. It's almost like a natural antidepressant in some fashion. Obviously, whatever is causing that is going to need to be addressed, the source of that, but it is a way that I wouldn't say it's the first thing that I would say to treat something like stress and anxiety, but it sure does have an effect.
Yeah, sort of like a byproduct benefit of the adjustment.
Yes.
Okay.
Yeah.
If you were recommending someone who wasn't in your area and they were looking for a chiropractor, what should they be looking for to see if a chiropractor was credible and effective?
Yeah. So this is a tough question because within the field of chiropractic, there's a lot of different niches. So there are some chiropractors who do a more manual adjusting approach, similar to how I do, where every adjustment is done by hand. And then there's others who use very, very gentle techniques, and they use instrument-assisted adjusting tools like a activator or a drop table or something else. And so you can't just do a Google search and see chiropractor and go and know what's going to happen exactly. Kind of like if you were going to the dentist, every dentist you go to, pretty much you're going to have a similar procedure done. And so this is both a strength and weakness in the field, and also makes it difficult to refer because you have certain patients that are going to benefit from one or the other. So you have to dig a little bit deeper into what kind of problem they're having and what approach. So you might go to I might recommend someone who's an athlete and having a problem with their shoulder to go to a sports chiropractor who's going to incorporate both adjustment and rehab exercises to strengthen that area, versus if I have a patient who's not as active, maybe they're a mom or they're a kid, they will go to a pediatric chiropractor who's doing more gentle techniques. So it just varies. There's chiropractors who are focused more on just the neck and upper cervical spine, and do more just like they do more mental fatigue, brain fog. They do techniques just for those type of symptoms, or chiropractors who they're the ones that you don't go and you don't get cracked or popped. And so sometimes people are really disappointed when they go to those people's office and like, what, I didn't get adjusted. And it's because they're kind of a different niche than what you were looking for.
Okay.
Yeah.
So those clients or patients need to sort of find what their niche is, what they're looking for.
What's
to
right
get out of
for them,
chiropractic.
Yeah.
You had mentioned clients looking for pops and cracks in the adjustment. Are the pops and cracks necessary for a high quality adjustment? And then second part to that question, what is the pops and cracks?
Yeah.
What is that with the body?
So I'll start with what is it.
Yeah.
So the pops and cracks are a nitrogen gas that's building up in pressure in between the surfaces of your joints that releases, and you heal that audible pop, crack, or we call it cavitation. And so what's happening there is the surfaces of the joints are becoming almost suctioned together to each other. And the way I once was described it, that made a lot of sense, is when you take a cold glass of water and you set it on the table, and you try to lift it up, there's almost a suction, a pressure that builds in between the surfaces of those two joints or those structures.
Mm-hmm.
And when you release it, you feel that pop or that crack, and that's that pressure escaping from the joint, the nitrogen gas escaping from the joint. And so that's what you're hearing. And then the second part, do you need to feel the pop or the crack in order to feel relief? And the pop and the crack is almost a byproduct of the adjustment. What we're really trying to do is introduce mobility into a joint. And if it pops and it cracks, great. If it doesn't, it's still getting the mobility that we were looking for, and that's ultimately the goal, keeping those joints moving and not stuck.
Okay. What has been your main demographic when it comes to chiropractic adjustments? Is there any demographic in particular that you see most?
I would say my primary demographic are adults, both men and women, between the age of about 25 and 65. 25 is the age where people start to settle into their movement patterns of daily life, and they start to be in the same positions, spending a lot of time. So that could be a lot of time spent sitting at their desk or sitting at the wheel driving, or standing for a prolonged period of time. You'd be surprised how much time we spend in a singular position when you add it up over the course of a week.
Mm-hmm.
Compared to when you're a kid and you're running around and you're active and you have sports. And not to say a lot of adults don't. It's a good thing if you're being active as an adult, but a lot of people don't. They're very sedentary. They're not moving as much as they should be. And so I would say adults 25 to 65 and even older. I've had patients in their 80s. And there's a differentiation too between men and women and the symptoms that they come in for. With men, it's a lot more lower back pain, acute lower back pain, and also neck and upper back tension. But with women, it's a lot more headaches, migraines, hip pain, and the difference, I believe, is due to their anatomy and physiology. Women, their necks have less extrinsic stability due to the musculature of their necks, and so there's more strain on the muscles in keeping this on straight. Also with hormones and fluctuations there. And then also with age, I see a lot of patients that are over the age of 50, and that's when the biological processes that maintain our youth really slow down and the effect is noticeable. And what I mean by that is, for men, it's their testosterone is declining. Also, their discs are starting to thin out, and so they're getting a lot more wear and tear on the bony aspect of their joints and their neck. And then with women, their estrogen levels are declining, and so their estrogen is vital in the processification of vitamin D, which maintains our bones. And so their bone density is weakening, and so it becomes more vital to maintain the bones and the joints between the bones.
Okay.
Yeah.
Okay. Good answer. What from a pricing structure standpoint, and then also from an efficacy of treatment standpoint, if I came in, I did my introductory session with you, what does it look like for me to purchase that introductory session and then move forward with do you do memberships, do you do packages, how does that look like? What does that look like?
Yeah, so that's evolved over time, but what it would look like for the typical patient is being seen once or twice a week for 2 to 3 weeks, and by then they should have some improvement or total improvement of the symptoms that they were experiencing. And from there, if they want to continue care just for maintenance of their body, they come in once a week up to once a month. Usually that first plan of care is a little more intensive just because you have more pain and there are more treatments that are needed. So it will be a package of visits up front, and then after that I have a membership that allows patients to come in on a weekly basis and get routine care.
Okay. And if I was an interested patient, what would be my best method to finding you, to reaching out and getting scheduled?
Yeah, so the best place to find me would be on Instagram. My handle is CDA Cairo, or coming in person here in Coeur d'Alene. I'm located in the shops downtown, the resort shops, inside Bioperformance Institute. My office is located inside their facility. And I am pretty walk-in friendly. If you book your first appointment online, or you can also just walk in straight into the office and I will try to accommodate you. But as I get busier, that's going to be more difficult, obviously.
Mm-hmm.
But yeah, that's where to find me.
Okay.
Yep.
Do you have anything else you wanted me to ask?
No, I think that's good for the time being. I was just focusing on answering the questions.
No, for sure. I mean, that was about 40 minutes, I think.
Really?
Josh?
Yeah. Holy cow.
Yeah, I know. It goes by fast, huh? Yeah. Well, cool. Well, if you don't have anything else, then I'm out of questions.
Okay. Well, let's do an outro real quick.
Yeah, let's do an outro.
Okay.
Sure.
So I hope you guys enjoyed our podcast. Again, Gunnar, let the viewers know where they can find you online, both online and in person.
Yeah, best method to find me is I am pretty active on my Instagram. It's Gunnar Amos, GUNNARAMOS, all one word. I have booking links attached to that specific Instagram. We also have our Bioperformance Instagram page. We have our website, calling in at 208-262-4539. Any one of those methods are going to be great ways to reach out to me, or even if you just want some free education, following me on Instagram, following Bioperformance Institute on Instagram would be your best methods.
Cool. And the place to find me would be also on Instagram is the best place, CDA Cairo. You can also find me in the shops downtown. You can message me there. I'm the one answering the messages. I'm happy to answer any questions before you come in.
Cool. Outro music activated. Dang, that was long, man.
All right.
Yeah, I was